there's a time where you will need to replace your veneers. And the reason why people were questioning themselves if they really wanted to replace a veneer or just maybe bond something over it is because removing a veneer till very recently was something that could be a little bit invasive for the underlying structure of the tooth if you were not really careful and you were really spending a lot of time trying to remove it. Why is that? Well, basically because you needed to grind the veneer until you reached the tooth underneath. However, sometimes it's very difficult to see the difference between the veneer and the tooth because the color is going to be very similar. So you have to be very, very careful and spend a lot of time if you don't want to remove too much of the tooth structure. Nowadays, things have changed, have evolved, and now we have new technology, and now we can use something like this. Yeah, this is an erbium laser, which will help us remove the veneer without removing the tooth that is underneath, without affecting the tooth that is underneath. How this is going to work? Well, depending on the parameters that you're going to use, you can basically target the bonding. You can target the cement that you use to bond the veneer with the tooth. And this is going to be basically like melting it down or softening it to the point where the veneer will either break or pop out completely. And then you just need to remove that little layer of bonding or cement, and then you'll have the same preparation that you had previously. And that's the way that you can really preserve most of the tooth structure when you're removing a veneer. So the benefit of using something like this is that you're going to be way more conservative than 5-10 years ago. And that's actually a game changer in restorative dentistry. So this is something that anyone should have in their clinic if they really want to deliver the best treatment options for their patients.